Okay, I might talk about some charities and things. Make sure I know all of them. I know there's Mind. There's that Sound Minds as well. I'm going to shout them out.
Sound Minds are really good.
They're so good. Honestly, so good.
Have you met her?
No, I've not met her. Actually, I think I have met her once. I think I might have met her at the barbecue. Sorry, recording and I'm just chatting away. Hi, my name's Baz and I'm a mental health pharmacist. So in the last video, I spoke about sleep and the importance on your mental health. And today I'm going to be talking about what it means to be sectioned and what sectioning actually is. So sectioning is when someone has been detained in a mental health hospital or facility against their will or agreement. And I know that sounds a bit heavy and scary, but it's a way for people who are experiencing severe mental health episodes to get the help that they need. So the legal framework that allows people to do this is the Mental Health Act of 1983. So that's the legal framework used to be able to section someone. There's lots of different ways to be sectioned, but I'll just talk about the two main ones that I come across in my daily practice. So Section 2 is when someone is detained against their agreement and they're allowed to be detained for a period of up to 28 days. And usually this is for in a period of assessment. So they can be observed in a controlled facility and get the help that they need. If after 28 days they're deemed to not be well enough to go, then a Section 3 can be put in place. And that's basically where someone can be detained for up to 6 months. And this usually includes being assessed and treated as well, because some of the medications that can be started need a lot of monitoring. And it might be that antidepressant or antipsychotic isn't working for them and they might need to try something else. So they usually allow a period of 6 months or even longer for them to be detained. So it sounds a bit crazy that someone could be detained against their will, but why this happens is usually people who are going through a severe mental health episode, whether it's severe depression or psychosis, they could be at a danger to themselves or to other people. And on top of that, they might be lacking the insight into their mental health condition. So they might not really be fully aware that they're having a psychotic or really serious depressive episode. And those are the people who need to be detained against their will so that they can be kept safe and be treated. It's not everybody who gets sectioned. A lot of people come into mental health hospital voluntarily, and we call that sort of informal or on a voluntary basis. So for a person to be sectioned, there are people who need to get involved. It's not just the decision of one healthcare professional. So it will be a second opinion doctor who needs to come in, the consultant looking after that patient, and then an approved mental health professional. And they all need to agree that that patient lacks the capacity to decide whether they should be in hospital or not. And in terms of treatment, it can be quite difficult treating somebody against their will. So we're always trying to work with people who are admitted to have a joint agreement about their treatment plan. But sometimes people really do just lack the insight and they need to be treated against their will. And again, there's a formal legal process and lots of people need to get involved before someone is treated against their will. Pharmacists get involved in that as well, and we need to make sure that the legal framework matches what is being prescribed. And often our opinion is sought on whether a patient has enough capacity to consent to treatment or not. So it can be really difficult to sort of balance the ethical and moral obligations to our patients with also making sure that they are well and safe. We're always doing things in the best interest of the patient, and we always have to make sure that we're maintaining their respect and dignity. So if you ever find that you're experiencing mental health issues or you just want to know more, there's lots of charities that you can check out. So there's the Mind charity, there's Crisis Lines, and there's Sound Minds, which is really great for psychoeducation, and of course the NHS website. I post a lot of content on my own page, Baz the Pharmacist. If you're interested, you can check that out, and I'll probably do a lot of mental health content on there as well. Take care. Should I just be like, bye everyone? Yeah.
I'll let you go.
Thank you so much.
Is that okay? Someone's end.